Hi, my name is Suhail, and I'm a gastroenterology fellow at SUNY Upstate Medical University in Syracuse, New York. I'm really excited to talk to you about our study on the sex differences which impact ergonomic endoscopic training for GI fellows. This is a very special collaborative effort between several GI fellows across the nation under the guidance and mentorship of Dr. Lauren Rabinovitz from Beth Israel Medical Deaconess Center in Boston, Massachusetts. I want to start with what inspired me to pursue this project. I have a personal background as an athlete pretty much my whole life and a college degree in kinesiology. And these things really made me curious about how the endoscopist moves during endoscopy and how we interact with our environment. And as I began to fall in love with endoscopy as a first year fellow, I really wanted to make sure that this was a practice that I was going to be able to do for as long as I can. That to me meant I needed to be physically fit and I needed to minimize injury. And I came quickly to realize that endoscopists are endo athletes. There's been several studies recently that have demonstrated that endoscopic related injuries are real and we can't ignore them. And we are seeing them amongst gastroenterologists with a pretty high prevalence of 39 to 89%. And this tends to happen when we're not correctly performing the right movements and techniques without the right equipment and doing this over and over again for many, many years. This can really impact patient care in the long run. With ergonomics, we can focus on the endoscopist's interaction with the endoscope, with the procedure unit, and with the equipment so we can minimize these injuries. Not only are we starting to see a rise in the number of females entering medicine, we are also seeing a steady increase in the number of female gastroenterologists, not to mention the growing interest towards advanced endoscopy. It was interesting to me to learn that our equipment, especially the endoscope, is designed for the male body type. But now that we are seeing more female trainees entering GI training, it's really important that we teach our female trainees safe endoscopic ergonomic practices and provide them with the appropriate equipment they need. For our project, we decided to perform a survey, and what was really special about our survey is our method of distribution. Each author was responsible to reach out to at least 10 gastroenterology training programs and identify a point person at that program to distribute our surveys. Our goal was to get a high response rate, and we felt that this personal approach we would be able to do that. And we were able to reach 709 trainees across 75 programs in the United States, and we had a response rate of around 34.4%. Our national multi-center evaluation of the incidence and type of endoscopic related injury and ergonomic education practice amongst GI trainees really yielded interesting results. To start, female trainees are shorter in stature and have smaller glove sizes. This is important because, like I had mentioned earlier, equipment in the endoscope is designed for male practitioners who are taller and have larger glove sizes. The one size fits all scope design really does pose a challenge for female gastroenterologists or all gastroenterologists who have smaller hands and might be shorter in stature and might have to assume a suboptimal position just to effectively manipulate the endoscope. We also discovered that female trainees tended to experience more transient neck and shoulder pain following endoscopies and also have an increased desire for better equipment, for example, dial extenders, which interestingly enough was recently discontinued by the company that made them. Female trainees also voice the desire to have well-fitting lead aprons and also wanted to have increased encouragement to use pediatric colonoscopes as well. Overall, though, all trainees should have equipment access that's readily available, including adjustable monitors and anti-fatigue mats. Our study also identified that trainees really don't have a strong ergonomic knowledge that is being formally taught. So we could know exactly what the appropriate, for example, bed height is in relation to our elbows. And this was evident by our 5-point knowledge test, and trainees scored an overall average of 66% between both genders. So what can we do moving forward? We need better equipment, keeping the endoscopist in mind, keeping various size and stature in mind. We need formal ergonomic training. We need informal training, which happens during our cases endoscopy suite, where our teachers consider the size of the trainee and stature as well. And what that also means that our teachers require formal training, not just how to practice ergonomics, but also how to teach ergonomics to various trainee sizes. Ergonomic practices need to be taught, and gastroenterology fellows need to learn this early in their training when we're first learning how to manipulate the scope and developing our motor skills. And these connections need to be made early when the scope first enters our hands. Thank you.